Hi, everyone. My name is Katie Brumfield, and I am the Colorado School Public Health Career Services Specialist. And today I'm speaking with Alysa Stuart. Alysa graduated from our school in 2018 with her MPH in health education and global health. Hi, Alysa.
Hi.
Can you start off by telling us what is your current job title and where do you work?
So I work for an agency here in Utah called Davis Behavioral Health. They are the behavioral health organization who kind of represents our county, Davis County here in Utah. So they're known as the LSAA, the Local Substance Abuse Authority. And my job title is Prevention Coalition Coordinator. So we have several different coalitions here in Davis County, and I lead the one in the city I live in called Layton. So yeah,
great.
CTC.
Great. And how long have you been doing this job?
I actually got it just over a year ago. So I think I started like in August of last year. So I've been doing it over a year.
Oh, cool.
I don't plan on leaving anytime soon.
Good. Could you tell us what a typical day in this type of position is like?
Yeah, so my day is really up to me. It's super flexible. It's all about community partnerships. And so coalition work is all about bringing community partners together. So I really just find out what my community partners need and try to meet that need. I run business meetings, so like it could be agenda planning. Today, my day was all about training, so data training and local data. So I brought community partners together to go through some of that data. But yeah, it's day to day. It's never really the same. It's always kind of variable on what the community needs, but it includes a lot of just data review, community member, bringing them together, meetings, seeing what they need, and really just talking to community members about what they care about. And a lot of it aligns with our priorities. And so kind of meeting their needs and what they care about and how we can help in partnering with that.
Wow, that's really cool. A lot of community outreach and relationship building.
Exactly.
And I'm sure it helps that you live in the community too.
Yeah, I had kind of a choice of which, when I was hired, which one I wanted to be part of. And it really meant a lot to me too, because this is the community I was raised in as well. I kind of community I was raised in. So it meant a lot to me to kind of lead the coalition work.
That is so cool.
Yeah.
That's so cool to give back to the community that you grew up in.
Yeah, exactly.
That's awesome. How would you say the Colorado School of Public Health has helped prepare you for this role?
Yeah, so I got my concentration in community health education because I care, like community was something I realized early on was like a value of mine. And really kind of bridging that gap between like the data scientists, like epidemiology and all that, and those kind of lay people, the civilians, the citizens, community members, and kind of how do you bridge that gap to bring them together? And that's really what my position is. And so in my concentration, I remember taking classes about community health education and how to, different strategies, whether that's coalition strategies, and, we did photo voice and we did walking assessments, right? And we did kind of those things, and those are things that I'm actually implementing in my own position.
That's so cool. That's so cool. I remember when you were a student, what did you do for your practicum? I feel like it was community work, wasn't it?
Yeah, so I actually, nonprofit work is something I'm passionate about. So I did my practicum and implemented kind of their strategy, like their strategic plan.
Yeah.
And practicum was developing their strategic plan for a nonprofit here. And it was all about mental health and kind of bridging that gap between mental health and and reaching kind of those different demographics,
Yeah.
populations who don't typically access it.
Yeah, that's awesome. What are some challenges you have faced in your career thus far?
I think the biggest challenge, I mean, to be completely honest, has been COVID.
That's
I
common.
mean, yes. With relationship building, it has been so hard to build relationships with community members when we're not meeting in person. We're doing everything over Zoom. People just aren't comfortable coming out to community events. I think that has been the biggest thing, but we've started, now that people have been vaccinated, we've started doing more face-to-face meetings and meeting people where they are. But yeah, I would say COVID, I started during the pandemic. So
yeah.
it's been kind of like I've started my whole coalition, off the ground in kind of a COVID pandemic. So it'll be interesting to see what it will be like after the pandemic, or as they evolve and people become more comfortable.
Yeah, it's so true. And what was that like, starting a new job during, like, smack dab in the middle of the pandemic?
Yeah, I mean, it was hard. I would say, like, all of our meetings, like, it was, remote working from home. So all of our meetings were just emails and Zoom.
Mm-hmm.
They were people that I've emailed, but, and Zoom, but I've never met face to face. And so again, with relationship building, it's so hard. And I feel like when you send kind of those, like, as a community organization, we have community board meetings, or just like that are just open to the public.
Oh yeah.
People don't want to do that to Zoom. Like, they don't want to just hop in. And so it's been hard, like, outreach wise, to get board members or community members to be interested in what we're doing. Because right now, or, we got a little bit creative in having face-to-face interactions.
Yeah.
But yeah, it's evolved, and I would say we were still pretty successful. We were able to establish a key leader board, over 20 key leaders in the community.
Wow.
To implement a community board with different work groups, and so we were
that's great.
In a COVID environment. So I felt pretty proud about that.
Yeah, that's awesome. I was just going to ask, do you have another example of something you're really proud of that you've been able to accomplish?
Yeah, we did, and this was in May. So this was, again, part of the pandemic, right? We did a big community event. We have a campaign here in Utah called Parents Empowered. It's all about how parents are the pro-social factor behind kids not doing alcohol underage, or using alcohol underage.
Yeah.
And so we did a huge Parents Empowered event, and we had lots of media. We got statewide media there. We had tons of law enforcement leaders and county commissioners come out for this event. And then we partnered with a local grocery store who actually doesn't sell alcohol, because they want to help prevent underage drinking in the community. And so, yeah, so it was all this, like, alcohol prevention campaign, but it was really successful. We got over, 100 people out to this event. During COVID, we gave out, like, so many donuts. It was ridiculous. We had little stickers that said, "Don't you know," or "Don't you know, parents are the #1 reason kids don't drink," and like all this. It was a great campaign, and I was really proud of it.
I love the donut thing.
yeah, like we were pretty proud of that. And even people who didn't want to come get a donut, this local grocery store is just known for their donuts, so people would Saturday morning and get boxes of donuts. And so we put these stickers on the donut boxes.
Oh, so cool.
Interact with us. They still got the message and took it home.
That's awesome. That sounds like a really great campaign.
Yeah, it was pretty cool.
That is super cool. What advice do you have for someone that is interested in pursuing a career like yours?
I think, I mean, my specific position is interesting. So I have several different colleagues, and we come from kind of different backgrounds. Like, I have someone who comes from, like, a public administration background. She got an MPA. I have someone who has a MSW, so she has social work background, and it's been really interesting to collaborate with these different disciplines in mind. And I would say, I mean, that's the biggest thing, is learning how to collaborate with the different disciplines, kind of being open, kind of thinking outside of your silos, right? We talk about that a lot of the time in public health, right? How to think kind of outside the box, outside of the silos, and partner and be flexible. You have to do that a lot in community work, capacity building, relationship building. You have to think about what you're doing in terms of what they're doing and what they need. And a lot of that is, I feel like doesn't come naturally. So it takes practice, it takes kind of those skills, and I'm always looking for kind of trainings and skills towards that.
What types of skills would you say are like the top ones to have in this career field?
I mean, it sounds so simple, but obviously it's not.
Yeah.
Is kind of that SPIF, the strategic prevention framework.
Yeah.
Right? I think it just seems so basic, but when you're implementing it in a community, it's not as basic as it seems.
Oh, I'm sure.
Going through that process, especially with community members who don't have kind of a prevention background or public health background, it's challenging, but it's rewarding in the end. That SPIF, or the strategic planning framework, right? Like, and that's something, I'm always trying to learn how to kind of, like, we talk about dumbing it down, not that you're actually like, but what grade level can you talk about these things? Because when you're talking about other professionals who know it, it makes sense. But then when you're trying to explain it to community members, it's not come across. So trying to kind of bridge that gap.
Yeah, I was just going to say, I'm sure it's a lot of communication skills.
Yes. Yeah.
A lot of listening to, what the community wants, and then advocating for that. But it seems like, you kind of always have this mindset of the future, having to, okay, let's build this for in the future.
Yeah. And it's really awesome to see when community members see that vision as well.
Yeah, that's true.
I may not have the public health or an MPH background, but I see the vision and I want to, kind of work towards that. So
yeah, that's awesome. That's really cool. Is there anything else we should know about your career field that we haven't talked about?
And it's probably just because I came straight from a data training on this, but risk and protective factors is like everyday language in my career field. And public health is kind of navigating towards that, right? So we talk a lot, like my area, our priorities are substance use, so like marijuana, alcohol, vaping, prevention, but also mental health, so depression, suicide prevention. And so to community members, it's so hard to be like, why do you, like, how, like those two things seem so separate in our health world. We know they're very intertwined, but if you go down to the risk and protective factors and, that model, it connects to everything, right? And same with risk and protective factors, but also social determinants of health, and really how do you go upstream? And so the upstream model is something that I like talk about every day in my job.
Yeah, no, that's really helpful. That's really, really helpful. And very, very, very good work, important work that you're doing for the community. Gosh.
Thanks.
Well, thank you so much for sharing your career path and what you do. And thank you for all the amazing work you're doing in public health. I hope you have a great day.
Yeah, same.